The Methodist Hospital Acute Rehabilitation Center, located inside a full-service community hospital in Omaha, Nebraska, provides an intimate setting for a comprehensive rehabilitation program. Acute inpatient rehabilitation is an important part of a person's recovery after an injury, illness, or accident. At Methodist, our patients, their families, and our team of compassionate and experienced professionals work together to achieve the patient's rehabilitation goals.
The interdisciplinary team is a huge focus for acute rehab.
We're all together. You don't leave the floor to go to therapy.
You'll have a pretty consistent group of therapists who will see you on a daily basis.
We have everybody here. It doesn't put all the pressure on one particular person to work on all areas of the patient.
Working so tightly with all of the therapists and the nurses, I feel like no stone is left unturned with our patients.
Everyone on the team is responsible for knowing the patient's goals.
On day one, if the patient's able to tell us, that's what we ask them. What are your goals for therapy? What do you want to do before you leave here?
So that they can return home and be safe and do everything that's important to them.
Every patient has something they want to get back to.
We have a lot of exercise equipment that we use, and we like to tie it into something functional.
A lot of them gear specifically toward a stroke or a brain injury, a spinal cord injury, something of that nature, to allow us to work on their walking.
We have a kitchen here so that you can practice cooking safely and make sure that you can move around the kitchen.
And family is welcome to attend therapy, and a lot of families are often very involved in therapy, so that they know what to do and can take over when the patient leaves the rehab facility.
I like to think of rehab as just the first step. So this is the first step to your recovery. This isn't the end. You might not be 100% by the time you leave here, but our goal is to get you safe enough and well enough to go home.
But when you've been in the hospital for so long, it can be really scary to go home and do things for yourself. So Independence Day can help relieve some of that scariness and some of that anxiety and make them feel a lot more comfortable that they really can do these things by themselves. And it's something that the other patients see and say, I want to be that person. I'm going to get a blue shirt and I'm going to leave. I think people should come to Methodist because of the people.
We're all kind of like a big family here.
We care about each other, and that extends right into our patients.
I feel really strongly that customer service and customer focus is really the best here at Methodist.
When the patient is number one on your mind and everything you think about is how you can help that patient, what is in the best interest of that patient, they'll get good care.
There's nothing better than watching your patient be able to walk out of here knowing that they've gained their independence back. That is why I come to work every day, knowing that I'm progressing these patients and watch them succeed. It's absolutely phenomenal.
Our family of therapists provide a unique, personalized approach to caring for the individual. Our ultimate goal is to assist our patients and their families to understand their medical or physical impairments and continue to enjoy the best quality of life possible.